My name is Louise Farrow and I am one of the lead chemotherapy nurses at the Kent Oncology Centre. My job is to coordinate the chemotherapy care that you will receive in this hospital. You will already have seen a consultant who has recommended chemotherapy and explained what it involves. Understandably, you will have many questions about your treatment, so we've produced this film to provide an overview of chemotherapy. During the film, you will meet some of the staff who may well be involved in your care. They will tell you about chemotherapy and what to expect. You will hear important information about your treatment and what you will need to do. Before your treatment starts, you will have an appointment with a chemotherapy nurse who will give information on the drugs prescribed and the possible side effects and ask you to give your consent for treatment. The delivery of chemotherapy is a very common and safe procedure. However, you must be aware that chemotherapy makes patients more susceptible to infection. In very rare cases, life-threatening infections can develop and patients may become seriously unwell very quickly. It is vital that you let your doctor or chemotherapy nurse know if you become unwell or have a temperature during treatment. In this video, we aim to answer your questions and concerns, but never be afraid to talk to your chemotherapy nurse or consultant at any time if you need further advice.
The safe delivery of chemotherapy involves a specialised team of doctors, usually oncologists or haematologists, pharmacists, chemotherapy nurses and clinical nurse specialists. We all work very closely at the Kent Oncology Centre to ensure individual patients get the very best treatment for their cancer. A multidisciplinary team will consider each case on its merits and decide which drugs that patient should receive and balance those against the side effects that the drugs are likely to cause. Chemotherapy is the use of medicines to treat cancer. Chemotherapy can be used alone, in combination with radiotherapy or surgery, and sometimes in combination with other biological drugs or targeted agents. Chemotherapy can be given intravenously or as an oral tablet or capsule.
As a patient, you are involved in the whole of that process. You will have an appointment with the consultant oncologist and they will give you all of the options that are available to you with regards to the treatment choices.
Of course, we always take the patient's wishes into consideration. The aims of the treatment, the benefits of treatment and the side effects will be discussed with you in great detail and the decision will be made in consultation with you.
You're then seen also by the chemotherapy nurses and another information session is given so that you are able to make a full informed consent in conjunction with ourselves. But clearly the end decision lies with yourself.
Chemotherapy can be used for a variety of reasons. In some cancers, chemotherapy will cure the cancer. We also use chemotherapy to reduce the risk of a cancer coming back. Chemotherapy can ease symptoms in patients with advanced incurable cancers, and in that setting, most of all, it improves patients' quality of life and makes them live longer with their cancer. Chemotherapy drugs circulate in the bloodstream to all parts of the body. They target rapidly dividing cells, mainly cancer cells, but unfortunately they also affect normal healthy tissues, and that's what leads to the temporary side effects, and we'll discuss those later in the film.
Chemotherapy is obviously given with the intention of trying to either maintain or improve quality of life in many cases, and certainly the experience in many cancer treatments and trials that have been done in the past is that actually patients who are given chemotherapy on average have a better quality of life as a result of the treatment rather than patients who are treated with supportive care alone. Although obviously there are downsides to chemotherapy with the possible side effects, overall our experience is that chemotherapy can certainly be beneficial, both in terms of controlling the cancer but also in terms of symptom control and quality of life.
Chemotherapy is drug treatment to fight against cancer. We use chemotherapy either to cure cancer or sometimes to reduce the burden of the cancer, which may then facilitate further treatment such as surgery or indeed radiotherapy. Chemotherapy can be used to palliate symptoms, to help people feel better. So although we're not able to cure the cancer, by going through a course of chemotherapy, patients will feel better with an improved quality of life.
Chemotherapy drugs can be given in a range of different ways. Most people think of chemotherapy as being intravenous, but increasingly there are a range of different drugs that are given through all sorts of different methods. A lot of new chemotherapy drugs come in tablet form. Some of them are taken once a day, twice a day. Some are capsules, some are tablets. If you look at the intravenous drugs, these can also be given in a range of different ways, because we traditionally think of the bit of plastic called a cannula in order to receive a drip. Well, yes, many chemotherapy drugs are given in that fashion, and some of these drips may take half an hour, 2 hours, 3 hours. However, there are some drugs that are given as intravenous pushes, which take very short periods of time, maybe a few minutes. There are also drugs that need to be given over a protracted period of time. So there are some intravenous drugs that may be given over several days.
Most patients can safely receive their intravenous chemotherapy through a temporary drip or cannula placed in a vein in the arm on the day of your treatment. This is removed on the same day before you go home. Occasionally, a more permanent line may be required to administer your treatment, and these lines usually stay in for the duration of your treatment. There are 3 different types of lines that we place, and these can be used both to take blood as well as deliver your treatment. The first, a Grochon line, is a fine tube that's passed into a vein in the chest under a local anaesthetic. The second, a peripherally inserted central catheter, or PICC line, are very similar to Grochon lines, but are placed in the upper arm, generally under ultrasound guidance. The third is a portacath. This is a small device that is placed under the skin in the chest, usually by an anaesthetist or radiologist. Portacaths are accessed via a special needle called a gripper, which are used for taking blood as well as giving you your treatment.
Every treatment's very different, but we give treatment in cycles. Typically that may be weekly or 3 weekly for 6 or 8 or possibly even 12 cycles, but occasionally we do give chemotherapy indefinitely. We will monitor you closely through clinics, so you'll be coming to see your consultant for some clinic consultations, and you may also come to see a specialist nurse in clinic. We will monitor you by assessing side effects and helping you with those, and we'll also monitor you by regular blood tests.
Well, chemotherapy works by affecting the whole of the body. Chemotherapy enters your body either through the tablets that you've taken or intravenously, and it works by attacking all rapidly dividing cells. Now, most of these cells are your cancer cells, but some are your normal cells, and that gives rise to the side effects of chemotherapy. Most of these are short-term and reversible, but some can be longer lasting and more permanent and come on later on after the chemotherapy is finished. Different drugs give different side effects, and different people react in different ways. It is important, however, that you tell the nurse or the doctor the different side effects that affect you, and we can therefore make changes to try and help you through your treatment.
Chemotherapy makes patients susceptible to potentially life-threatening infection. We call this neutropenic sepsis. Chemotherapy reduces the numbers of normal circulating white blood cells, so it makes patients more susceptible to infection. Some patients will receive a short course of subcutaneous injections for a few days after their chemotherapy to boost their immunity, and these are very effective at reducing the numbers of patients who come into hospital with chemotherapy-related infections. We ask our patients to contact the emergency helpline if they suffer any of the following: a temperature of 38 or more, symptoms of chills or shivers, or symptoms of an infection such as sore throat, cough, burning when they pass urine, diarrhea, or a wound infection.
I think the most important thing to do is to have an awareness of your temperature. It's a good idea to have a thermometer available, and if you do feel unwell during the treatment, if you could take your temperature. If the temperature is raised to 38 degrees or higher, we would want you to phone the emergency helpline, and the chemotherapy nurse will direct you up to the nearest accident and emergency department, where you would have your blood count checked, your temperature checked, and if necessary you would require immediate intravenous antibiotics. It is a bit scary, yes. Fortunately this doesn't happen very often, but it is very important to know what action to take, because if the infection is not adequately treated, it is possible that you could become seriously ill.
Well, one of the most common side effects that patients associate with chemotherapy is sickness. And as doctors, we think of nausea, which is the feeling of sickness, or actual vomiting itself. We have a lot of new anti-sickness medication that we're able to give routinely to patients who are having chemotherapy. So it's fair to say that nausea and vomiting are side effects that are very well controlled with modern chemotherapy schedules. Having said that, there will always be a proportion of patients who still suffer from nausea and vomiting, and it's very important to discuss that with your oncology team after your first treatment, because if we have prior knowledge that you've had sickness with a treatment, we can increase the number of anti-sickness medications and the range of medications to try and alleviate that side effect so that you can continue your chemotherapy safely. A lot of chemotherapy drugs will cause some degree of bowel disturbance. It's very common to get constipated for a few days after chemotherapy, and that's usually a side effect of one of the common anti-sickness medications that's given at the time of the chemotherapy treatment. That can last a few days, and then it resolves of its own accord. Some patients feel the need to take laxatives for a few days to help support them through that particular problem. Some chemotherapy drugs can cause diarrhea, and although diarrhea can occur, if you look at the drugs that cause diarrhea, not everyone who has the chemotherapy will get that particular side effect. A proportion will, however, and it's important that that's managed appropriately. It's very important that if you get severe diarrhea that you make contact with your chemotherapy team as an urgent issue, particularly if it's not controlled. The diarrhea can be very well managed. There are medicines that can help control it, and sometimes we have to lower the dose of chemotherapy by a modest amount.
Not all chemotherapy drugs cause you to have hair loss. Some certainly cause you to have either hair thinning or profound hair loss. The chemotherapy nurses can advise you about things such as wigs, or scalp cooling is something that can also be discussed with you if it's felt appropriate. And we can provide you with scarves, wigs and other measures to help with the hair loss. Your hair does come back after the chemotherapy is finished.
Hair loss due to chemotherapy can be a very distressing time for them, for both men and women, and helping patients with hair loss is very important, especially I would say for ladies, because hair is particularly part of their personality and femininity, whereas men tend to have very short hairstyles, so their hair loss doesn't seem to be so much of a problem as it is to ladies.
So some chemotherapy agents cause you to develop a rash. If you notice a rash, we'd ask you to contact the medical team looking after you, as we can provide creams and we may have to adjust the medication accordingly. Some agents cause soreness in the hands and the feet that may interfere with fine movements and cause problems with walking. It affects the soles of the feet. Again, if you let the medical team, the chemotherapy nurses know, then there are creams and agents that we can use.
Surprisingly, most people find that they do get through the treatment well because they're supported by the nursing staff and the other team members, and there's plenty of other support for you to utilise. We have to let you know all the side effects occur so that you know what to do when you get them, but most people do get through the treatment without suffering unduly.
Well, one of the most common side effects of chemotherapy is fatigue. Most patients do suffer some tiredness during chemotherapy treatment. It can be helpful to take some light exercise during treatment, such as walking, and that can help alleviate symptoms of fatigue in many people. Chemotherapy also quite commonly causes ulceration or soreness in the mouth. We commonly use mouthwashes to help treat those kind of problems, and the nursing staff will advise you about the most appropriate treatment to use in your individual case. Allergic reactions are quite uncommon with chemotherapy, but sometimes they do happen, but they almost invariably will happen during the chemotherapy infusion itself. And obviously the nursing staff are very well experienced with dealing with these kind of problems. This very rarely causes any long-term harm.
Some chemotherapy drugs can cause nerve symptoms, mainly numbness or tingling of the fingertips and toes. And some drugs can also cause hearing loss or tinnitus, ringing in the ears. If you notice any numbness or tingling, it's important to mention it to the doctor or nurse, because some drugs we may need to modify the dose. These are usually temporary and they do resolve, but with some drugs it can take several months and it can be a slow process of recovery. And very occasionally the sensation may not completely recover or return to normal. And the kidney function will be monitored by blood tests. So you have a blood test before each chemotherapy drug to check your kidney function.
Sometimes chemotherapy leaks from outside of the vein, and this can cause damage to the tissue surrounding that vein. So it's very important you let the nurse know straight away if you feel any pain during the administration of your chemotherapy, as we can take measures to help reduce any damage and pain. Your taste may be affected whilst you're having chemotherapy. This can happen just for a short period after each administration, but some patients do notice that the taste change is throughout their chemotherapy treatment period. Some patients notice just a change in the sensation of taste, whereas others lose their taste completely, and some people report a metallic type taste. Some treatments can affect the nails. Patients sometimes report their nails grow less quickly. They sometimes look different, they sometimes look darker or more rigid or brittle. Other patients experience changes to their skin. The skin can become more sensitive and more dry. And some drugs have a particular side effect where they can cause rashes to the skin, and we can give treatments to help with these. Some treatments have a particular side effect where they can affect the hands and feet, and the skin can become tender, slightly red and sometimes sore and peeling. If you let us know straight away, we can add in extra treatments to help reduce this side effect. Some patients are given steroid tablets to take before they commence their treatment, and this is to help reduce the possibility of a reaction whilst having the chemotherapy. And most patients are given some steroid tablets to take in the days after treatment, and these are mainly used to control nausea.
So steroid tablets are used as part of chemotherapy itself, as part of the regime. They can also be used as an anti-sickness medication and may be given as part of the anti-sickness protocol before and during the chemotherapy. So they are useful drugs, but they have some potential effects. Some people find that they encourage them to eat a little bit more than than they did before given steroids. Occasionally they can affect your sleep, and so we usually advise you to take steroids slightly earlier in the daytime so that it doesn't give you insomnia. Very, very rarely, sometimes people can feel a little agitated or a little bit more hyperactive because of a side effect of the steroids.
Some chemotherapy can cause muscular aches and pains and flu-like symptoms, which can develop during or after the chemotherapy and can last for several days. And simple analgesia such as anti-inflammatory drugs or other painkillers can help this. Chemotherapy can cause infertility in young patients. And it's important that you discuss this with your doctor and they will go through the implications for you. But it's also important that every patient on chemotherapy uses barrier contraception for various safety issues and also to prevent pregnancy.
Some drugs will have an effect on the periods. This effect may be temporary or permanent, and your consultant will have talked to you about how this relates to you and your treatment program. We know that patients who have cancer and also patients who have had surgery are more prone to blood clots. This includes blood clots in the legs, which we call deep venous thrombosis, and dispersion of the blood clots to the lungs, which we call pulmonary emboli. These are also slightly more common in patients who are receiving drug therapy, chemotherapy and other agents for their cancer. Some chemotherapy agents may have an effect on the heart. The effect on the heart may be a little weakening of the heart muscle, and your doctor will have talked to you about the ways that we monitor that during your treatment. It is possible that some patients will develop an irregularity of the heart rhythm, and again your doctor will have talked to you about how likely this is to occur and what action we would need to take. Essentially, we would want you to report anything that you notice in terms of an irregularity of your heart rhythm, or indeed things like a reduction in your exercise tolerance, chest pain or shortness of breath.
I think different people cope with chemotherapy differently. I mean, it can be quite frightening. You get given a very long list of side effects. But the important thing to remember is that not everybody gets all the side effects to a severe degree, and we're all here to help you get through the treatment, and the side effects will be monitored carefully.
All patients find the prospect of chemotherapy very daunting. However, in my experience, most of them find that whilst it's not been an enjoyable experience, it's never quite as unpleasant as they expect. One of the difficulties is predicting which patients suffer which side effects, and we reassure them that no patient suffers all the side effects we describe, but the range of side effects that an individual patient experiences is very unpredictable. But for the majority, they're manageable.
There's quite a few local support groups within the hospital, and there's breast, there's prostate, so there's different support groups. So what we can do, if we can actually signpost people to those support groups. We also have the counselling service as well, and we also run a workshop which is called the Look Good Feel Better workshop, which is a makeup workshop for women that they can go to. So yes, we can signpost people to different support groups within the hospital in the local area, so they can meet people who are actually in the same boat as them and find that support.
Clinical trials are the only real way to evaluate how good procedures, medical devices are in humans. And for that reason, some of the treatments that we offer here will be given as part of a clinical trial. So you may be approached to be part of a clinical trial, but it's always important to ask your clinician, your doctor, your nurses looking after you, whether there may be a trial that's suitable for you as well. Clinical trials are very important for us to find better and new treatments. They're also important to look at cost benefit, risks associated with treatments, the potential side effects associated with treatments, and ultimately to find better treatments to cure the disease. When patients think about clinical trials, some patients may have a concept that they're being guinea pigs, some drugs are being tried on them, and that's not the case. The clinical trials, everything is done in a very controlled and scientific way, and again the role of the research nurse is there to provide all the information about the clinical trial, to know that their choice is voluntary, and to manage their pathway of care within the clinical trial. So it's okay to ask your clinician, your doctor about clinical trials, and it's okay to ask any professional that's looking after you during your treatment about the possibility of participating in a clinical trial.
For most patients, chemotherapy is a very daunting prospect, but most patients find that although they do suffer some temporary side effects, the experience is not as bad as they feared. You may have many more questions that you will want to ask. Remember, we are here to help. Feel free to ask one of the nursing or medical team if you have any concerns. Further information is available on the Kent Oncology Centre website.